So good morning, or good afternoon actually. Thank you for coming along. I've been joined by the Testing Commander and the Chief Health Officer just for an update on where the circuit breaking efforts to get ahead of this Holiday Inn cluster are at today. So currently there are 21 active cases of coronavirus in Victoria. There have been 2 new locally acquired cases notified to the Department of Health in the last 24 hours. One is a returning traveller in hotel quarantine. Yesterday there were some 21,475 tests received, bringing the total tests to 4.694 million. In regards to the Holiday Inn updates, the 2 new positive cases that we are reporting today are both linked to the Holiday Inn at Melbourne Airport, bringing the total number of linked cases in that cluster to 16. The 2 most recent cases are a child and a woman, both who attended a private dining venue in Sydney Road, Coburg on the night of the 6th of February. They are from separate households. And both have been in isolation since the 12th of February, and both tested and returned a positive sample in isolation on the 13th of February. We've conducted tracing interviews with them, and we can advise that as a result, the following Tier 1 exposure sites have been added to the list of exposure sites. If you have been to these sites in the time specified, you must isolate, you must contact the Department of Health, get tested and stay isolated for some 14 days. The sites and the times are: on Monday the 8th of February, the Elite Swimming in Pascoe Vale from 5 p.m. to 6 p.m. On Tuesday the 9th of February, Woolworths Broadmeadows Central from 12:15 p.m. to 12:30 p.m, closely followed by the Ferguson Blair Bakehouse in Broadmeadows Central from 12:30 p.m. to 12:45 p.m. And finally, on Wednesday the 10th of February, at the Oak Park Sports and Aquatic Centre in Pascoe Vale from 4 p.m. to 7:30 p.m. Again, if you have been to these sites, you will need to isolate, to get tested and to stay isolated for 14 days. That goes above and beyond the general circuit breaker that we're currently in. These test sites, these sites of Tier 1 exposure require you to isolate for 14 days if you have been in them, not the 5. So isolate, stay home. Please do not leave home for shopping or for work or for study. We will support you in every way you need to get through those 14 days. There are other sites who we have previously advised, and you can see those other exposure sites at coronavirus.vic.gov.au and click through to Case Alerts, public exposure sites. In regards to the Holiday Inn numbers more broadly, yesterday we had identified some 996 known primary close contacts related to the Holiday Inn Melbourne Airport. Today, that number is 940 as we work to clear out a number of exposure sites, and this number will fluctuate up and down as some sites, as we've added today, are added to the Tier 1 exposure sites, and others are cleared as a result of the work of the contact tracers. Of the 940 today, 129 are direct family, workplace and other immediate close contacts, and that's across all the different groups that we've identified through this cluster. This is the closest ring to those cluster members at the moment. Of that 129, 127 have tested negative, and 2 further test results are due shortly. In addition, we can advise that of the 1,567 contacts identified through the exposure site at Melbourne Airport Terminal 4, that we are working through and having contacted through our tracing teams, call in all of those 1,567. More broadly, our performing over the course of the past week in regards to these new primary close contacts that have come in, particularly in more recent days, has reached and exceeded all the national benchmarks for contact tracing in this space. For the 10th of February, 98.7% of new primary close contacts were contacted within the 48-hour benchmark. The day before that, the 9th, 98% were also contacted. On the 8th, 98.7%. On the 7th, 99.2%, and so on. All of these figures are tabled through the AHPPC National Cabinet reporting processes every week and are there for all of us to measure. I wanted to also talk briefly about our pathology lab capacity. I want to thank all of those more than 20,000 just about every day of the past week Victorians who have come forward to get tested. It is the singly most important thing we can do to both keep ourselves, our families and the wider community safe. And it also is critically important as we list exposure sites to get people tested and clear those exposure sites. For the most recent confirmed positive cases, the average time when it comes to the pathology turning around of those labs has continued to improve. The Department of Health, from the average time of being notified by the Department of Health of their positive result from pathology to their interview, has been 2 hours. If you include the time it took for those test results to be analysed and returned by our labs, the average time from arriving at a testing site, getting swabbed, being interviewed as a positive case was 17 hours. This is a rapid turnaround by both our public and private labs, and I want to thank our pathology team for their continued efforts in improving over the course of the past 12 months as they get better and better at their job. The number of test results the Victorians can process and turn around in these 24-hour timeframes as a result of that has significantly increased. In fact, from October to now, our testing process capacity has more than tripled within our 8 public laboratories. There's a reason for that, because we have invested and we've put in place new equipment, new staff and new resources to make sure that our pathology supports our wider test, trace and isolate system. At the heart of this are some new 5 high-volume testing machines in our laboratories at both the Royal Melbourne and Monash Health. All of that work means that both across our public and our private partner labs, we can process some 30,000 tests a day and provide more than 80% of those results back within 24 hours. This is important for the very reasons that we are dealing with right now, to respond with certainty and speed to clusters when they occur and get those results back to Victorians so they can have the confidence that when their results are negative, that they can either continue to isolate or, depending if they're secondary contacts, be cleared. The faster we get a positive result, the faster we can start the interview process that needs to be established, and the sooner we will make sure that we get on top of this cluster. Its speed, its support for this is at the heart of our public health response that needs to be wrapped around people with the certainty that we are on top of this. And the people of Victoria need to be reassured that it is very likely that if they get a test in the afternoon, that they will have their result back the next day, then more people would have the confidence to come forward and be tested. And this investment and this increased systems, capacity, technology and people from our pathology labs are some of the unsung heroes of our pandemic response, and I want to give them a particular shout out. I will now ask the testing commander to update in some more detail and some arrangements around particular cases and possible cases, and then myself, the testing commander and the Chief Health Officer will take questions. Thank you.
Good afternoon. Thank you, Minister. So in terms of the Holiday Inn outbreak at this point in time, as we've said, we've had 21,475 tests since yesterday. We've also had 7,911 negative test results already coming through this morning. And at 8 o'clock, 9 o'clock, there were a further over 7,000 tests already in the labs being processed. And I'd like to add my thanks to those of the Minister for the fantastic pathology teams we have across our private and public labs and the phenomenal work that they do, and also the testing teams particularly, who are moving all around the state at this point in time to provide additional testing capacity, both to public sites, but also, of course, in our hotel quarantine system. They do a phenomenal job and a very critical one at this point in time. We have really now closed out over the last 24 hours a number of the key lines of inquiry in this Holiday Inn outbreak. You'll recall over the last few days we've been talking about a couple of school locations, Camberwell Grammar and Avondale Primary. Both of those have now all returned negative test results. They have been excluded from this ongoing outbreak investigation. The RAAF site at Point Cook and the Coates Hire at Werribee, again, have also both returned all negative test results and have therefore been closed out from our investigation. Yesterday we spent a fair amount of time talking about the Brunetti exposure. One of our positive cases there had worked at the Brunetti Cafe at Terminal 4. I'm pleased to confirm that all of her 12 work colleagues at Brunetti have all returned negative test results. Of the 34 customers that we believe visited Brunetti's during the time that she worked there, 19 of those are interstate and are being supported by our interstate colleagues, and my thanks to our health teams in other states for the coordinated way in which we continue to work. We have 15 of the Brunetti customers that are in Victoria. 13 of those have now returned a negative test result. I've got two test results pending for the other two. That'll be through later on today, I'm sure. As the Minister said, we have around just under 1,600 people who passed through Terminal 4 on the Tuesday the 9th in the morning. They've all been contacted and we continue to speak to, we spoke to hundreds of them yesterday, we continue to speak to hundreds of them today to make sure that they're isolating effectively, that they get tested, and of course to identify whether there's been any spread from that area. I think at this point in time, we will continue, of course, to close out our investigations around Terminal 4, but that feels in a steady space. I'm also pleased to confirm that we've talked about a cleaner who worked also at Terminal 4. Coincidentally, all of their workplace primary close contacts have tested negative, so we've excluded that from the ongoing outbreak investigation. As the Minister has said, we now have a focus on a couple of new cases overnight. So a focus on a young case, a 3-year-old child at the Good Start Early Learning Centre at Glenroy, who was also at 2 of the swimming pools that the Minister has mentioned and that are listed as public exposure sites. We are pivoting our response to that from late last night. I'm pleased to confirm that all the primary close contacts that we've identified have already been spoken to, and we continue to then work through the ongoing investigation, and we'll update that over the next few hours. We also have a case that we are still investigating. It's a possible case. It has not yet been confirmed. It is the mother of the 3-year-old. She has returned 3 separate test results in the last 24 hours, all with differing conclusions, and our epidemiologists and specialists are working with her and with our labs to be clear about the nature of what possible infection she may have, whether she is at the very start of her infectious period or whether she's coming towards the end. Serology is being done, and we will work out over the next few hours exactly where this individual stands. She does have some workplace contacts, particularly with Alfred Health. We are working very closely with Alfred Health to do preliminary testing, precautionary testing really, of her potential workplace contacts. That's all being done. Some of those have been done already, and I spoke to Alfred Health CEO earlier today. A very controlled process in place to manage that. And again, if this does turn out to be a possible case, then we've already got those appropriate steps on hand to work through. In terms of our wider testing operation, again, we continue to see 20,000 plus days of testing, and my thanks to every single Victorian who's coming out to get tested over the last few days and who continues to do so. As I've said many times, particularly with this outbreak, because it is such a wide geographic space, and because, again, some of the exposure sites cover such a large part of the metropolitan area, I would urge all Victorians who have any symptoms whatsoever or any concern whatsoever to come out and get tested. If you're even thinking about it, you should just go out and get tested today, and please make sure you do. We've got new drive-through sites up and running at Coburg Lake Reserve, up in Coburg North. We've also got some additional smaller pop-up sites being deployed around the exposure sites, and of course all of our sites are running with extended operating hours over the weekend. Can I also sincerely thank all those phenomenal health and support workers who are out there right now doing all this testing work. Their agility and ability to run for extended operating hours, to move across the city at such speed as we support communities in different parts of the city to get tested has been phenomenal. They've been doing this for a very long time, and it's great to see how they continue to serve the whole state in doing so. That will be a continued focus of our efforts over the coming week. We've also talked, of course, a lot about our wastewater work, and that wastewater analysis becomes ever more detailed and granular. We've got two particular wastewater detections that we are currently investigating. One of these is in the Coburg catchments, which takes in Coburg, Coburg North and Reservoir, and the other is in the South Melbourne catchment, which is essentially down the South Melbourne sort of Punt Road, Clarendon Street area, which we are keen to understand more of. We do have a couple of exposure sites, a couple of cafes in that area that are listed on our website. So I'd really encourage people who are in Coburg, Reservoir, South Bank, South Melbourne to really be extra vigilant and come forward to get tested if you have any symptoms. With that, I will hand back to the Minister for any questions for the three of us.
Why isn't the Premier here today?
I beg your pardon?
Why isn't the Premier here today?
The Premier is, like all Victorians, working from home. The Premier is deeply engaged in the management of this cluster. I know that. He's got several meetings on this issue over the course of the day, and if you can work from home, you should work from home.
You failed to answer any questions on the nebuliser issue yesterday. Given that there's growing discrepancy between what he says caused the outbreak and what the man accused of starting it says, surely he should be here and answer questions.
I think what everyone put on the record yesterday is on the record. I'm the Minister for Health. This is a public health emergency. Since I've been the Minister for Health, I have made it crystal clear that I do not comment on individual cases and put people and families through trauma, and I will not be starting that today. This family needs to put all of its effort into getting well. That's my message, and what's on the record from yesterday stands on the record.
The man says that he was given permission to use it. Will you investigate further?
I refer you to all the comments that were on the record yesterday.
Minister, can I ask about the response? It seems to be working from the figures that you've released today. Can Victorians be confident that it is in hand and that you won't need to extend the snap lockdown period?
So what we've reported on today is the first day of a 5-day quick snap shut to get ahead of this. It's too early to say whether we've been successful, but the signs that show Victorians are doing the right thing, backing each other, that our test, trace and isolate system is staying ahead of this, that our pathology system is up to the scratch. All of these are positive measures, but it's too early to say as yet whether this fantastic effort by all Victorians has got us there. We'll continue to monitor it on a day-by-day basis, and it's really up to the shared effort of all Victorians.
The mother of the 3-year-old, she works at Alfred Health. Does she have anything to do with the hotel quarantine program, or do any of her contracts have anything to do with the hotel quarantine program?
I've missed half of that.
So the mother of the 3-year-old, she works at Alfred Health. Does she have anything to do with the hotel quarantine program?
I'll stand to be corrected by the commander, but she doesn't. But the common link is someone who did work at the hotel was at that exposure site at Coburg, where there was a private function where she was in.
Can you explain to us the nature of that function? Was that a wedding, a dinner?
A private family function, as I understand it.
And just on that timeline, and also that the person who tested positive to COVID yesterday, who was at the Coburg venue, how are they connected to the hotel? How are they connected to the Holiday Inn cluster, and whose close contact are they?
Through the same process. So today's cases and yesterday's cases were all at the same event through a person who was at the Holiday Inn.
And, okay.
So the last 3 cases over the last day have all been at the same venue, and at that venue was one of the workers from the Holiday Inn.
So there was a hotel quarantine worker who was at the Coburg venue?
That's right.
Yes.
Okay, and when did they test positive to COVID?
Which one?
The hotel quarantine worker who was at the Coburg venue?
I'd have to go back and check my notes, but why don't we get you that specific detail? But earlier in the last week.
So just to be clear, today's 2 cases, we've got the 3-year-old child, and what's the nature of the other case?
An adult woman from a
The-
separate household.
Right, so, and then the mother is additional, the mother of the 3-year-old is a potential additional.
Correct.
there.
All from this significant event in Coburg.
Given we knew about, I guess, the first hotel quarantine worker testing positive on the 8th of February, the worker tested positive in earlier stages of the week, as you mentioned. Is there any reason why we only found out about the Coburg venue as an exposure site just yesterday?
I'd have to check those exact dates and get back to you, but through the contact tracing interview process, as data and sites come to evidence and processes have gone through with people, that's when they're reported. So I'd have to double check when that Coburg site was listed as a Tier 1 site. I think it was before yesterday,
It was
but
very, very late Friday.
there you go.
But very late Friday, technically early Saturday morning.
So when the information comes to hand, that's when the sites are published.
Has there been a lag then in the information coming and then in the contact tracing process?
I don't believe so. As the interviews happen in those time frames that I've indicated, very, very quickly from the dates, from the times in which they are posted, on average 2 hours over the course of the past week, as soon as that information and intelligence is gathered, as soon as those Tier 1 exposure sites are confirmed, they are put up on the Tier 1 exposure risk sites.
How many people were at that function last Saturday night?
38?
So, yeah, and that, so we've been...
I might get Jeroen, he's got all of these
Sure.
figures at his
Thank you.
fingertip, but
Perfect,
he's
thanks.
the source on this.
Thank you. So how many people were at that function? And we've also been told by locals that it's a venue that hasn't been in operation for quite some time, but it's listed as a public exposure site.
That's
Can you
right.
just give some context there?
Of course. So just maybe just to take the story back, and we'll kind of work forward again. So there was a private family gathering at the venue that we listed. That took place on Saturday, the 6th of February. There was a CQV staff member there who was not known to be positive, of course, at that time, who attended that venue, that family event with her household members, 2 household members at least, and a number of other people. There were 38 people in total who are associated with that extended event. All of those people have been tested. There are a number of positive cases that have come out have now been traced back to that event. So we have, of course, the CQV staff worker who subsequently tested positive a few days later. We have her housemate, her partner and her housemate, 2 more people. We have the 3-year-old child, which we identified late last night. And we have another woman in her 50s who was also identified last night. They were all separately at that particular venue. And the mother of the 3-year-old was also at that venue. So all of those people have been tested. Everybody else who was there and the people who worked around have all been tested. Apart from the ones that I've mentioned, they've all tested negative. So we're confident we've got a good ring around that particular event. But it is a notable event, and that is now the lead line of our investigation, having dealt with all the other lines of investigation I discussed earlier on today.
Why did it take a week for us to hear about it?
So the testing progress with this has been is that the CQV staff member we identified her on Wednesday. She tested positive on Wednesday of this week, so that's the 10th of February. At that point, the social contact point on the Saturday was not identified in those early conversations. There was a negative test result that she returned as part of her normal workplace testing on the 7th. That has since been reviewed. That test is now a week positive, and therefore we've had to take the timeline back to include the 6th. The event on the 6th was identified late on Friday night when we released it as a public exposure site. To go to your question around why is it a public exposure site, we understand, and obviously our teams have been working closely with those involved in this. It was formerly I think a public restaurant type venue. It is now operating as a private venue under some circumstances. I'm not an expert on private dining venues, but we are confident of the nature of the event that took place and who was involved. Everybody involved has been highly cooperative. That's why we've managed to track them all down during the day on Friday night, get them all tested yesterday and return all those negative results yesterday and identify the positive cases.
So the
yesterday.
worker at the centre of all of this actually had tested positive, but the test result was unclear and she was walking around positive?
No, so the worker at the worker who is one of the CQV staff members who we'd identified on Wednesday with a positive test result. So she was tested on Tuesday, returned a positive result. We identified that on Wednesday, and we've been working with her ever since, and her household unit. There have been a couple of other people in that household unit who have also now returned positive results. We've talked about those over the last few days. As a staff worker, she was also in the normal staff monitoring program. She worked on Sunday the 7th of February. She undertook a normal workplace test, a nasopharyngeal swab, on the 7th of February. That at the time returned a negative result. We have reviewed that result on yesterday. We reviewed that negative result. That sample has been reprocessed. It's now returned a weak positive result. That is our lead assumption at the moment is that she was possibly a positive case on the 6th and on the 7th, having contracted it on the 3rd and 4th. The genomics is clear that this is all part of the same strain. It all comes back to the original index cases that we've talked about in the hotel, but that is the source that we're talking about.
Would you say that's a significant failure in the system then, that she managed to walk around for 3 more days positive?
No, she was identified. So remember, if you go back to the timeline, on Sunday night we picked up the first positive case. The first positive staff worker at the Holiday Inn was the authorised officer. That was identified on the Sunday, the 7th of February. That's where the decision was made to furlough a number of staff, to isolate a number of staff. We identified a further staff case on the Tuesday. That's when the decision was made to close the entire hotel, and that's when all those staff were locked down. So the staff go through their daily testing program. We have always known that there is the nasopharyngeal tests are, and Brett can comment this better than I can, 99.x% accurate. When you've done 110,000 tests in any single program, there will always be a number of false negatives and false positives. And it looks like in this case that the staff worker, the CQV staff member, returned a test that was a false negative on the 7th of February. We have since investigated that, identified it as a weak positive, and we are therefore identified as a result of that this social contact. Stress again, the people who are at the heart of all this have been cooperating fully and have done what they needed to do. The staff worker isolated and quarantined at the time she needed to. Her households isolated and quarantined when they needed to. We've identified all the people coming out of this investigation. That's why we've been able to close down all these other lines of inquiry. That's why we have in the region of 30 negative tests coming out of the event on Saturday the 6th of February, and all the other positives are now contained, as are their primary close contacts.
How come this wasn't initially identified in that double ring fencing process then?
So it wasn't identified because the infection. It was identified. We identified the staff worker when she returned a positive test on the Wednesday.
But wasn't she already a close contact of the previous workers?
No, she wasn't. So she was. Remember, there are 4 CQV staff or CQV and hotel staff who have returned positive tests throughout this investigation. We had an authorised officer on Sunday the 7th of February. We have a food and beverage worker on the Tuesday. We have this particular individual on the Wednesday. And we had an assistant manager who I think was declared on the Friday. I need to check my notes on that one. So we've had 4 separate workers, all unrelated to each other. This individual CQV staff worker who attended the party was identified on the Wednesday. We identified the connection to the event late on Friday night, when we identified the social contact who was the lead of our inquiry on Friday night, Saturday morning. We pivoted to this group, cohort of 38 people, all identified, all quarantined, all tested, 30 of them negative, and the other ones are either known positive cases we were already aware of, or the 2 new cases we're working on today, and the possible case, I stress possible case, that we're also working on a precautionary principle.
Prior to that Saturday family function, when had that CQV worker last been at work and tested negative?
She would have, and again, my recollection on this one is that she was at work on the 3rd and 4th of February, and she tested negative on both of those days. Remember, the initial contact event, we believe, was on the 3rd and 4th of February. Go back at the 3rd floor at the Holiday Inn. And it highlights again, I think, a conversation we probably had, I think, last Friday, which is the rapidity of the transmission. So we have a staff worker who is exposed on the 3rd and 4th of February. She now turns up at a social gathering on the 6th of February, and there's an immediate transmission onto a number of other people. And again, Brett is better qualified than I am, of course, but that is a very rapid onward transmission from her initial contact onto other people in her social circle.
Are we right to call this a baby naming event or a celebration for a baby naming?
I wasn't there, I wouldn't know what it was.
Going back to that venue in Coburg, do you feel that all the COVID safe protocols were actually being adhered to there?
Oh, look, I think.
Small little venue.
Oh, look, again, at every single turn of all of these outbreak investigations, we only have one principle, which is that our absolute priority is to identify people who might have been exposed and to work with them and support them to deal with both their potential exposure, to identify their contacts, primary and secondary, and to make sure they're all being supported and are locked down. So I'm not remotely interested at this point about who did what over what period of time. It is about identifying everybody who's been impacted. We've spoken repeatedly to individuals and wider social members of people who've been involved, both in the gathering on the 6th, as well as the ongoing contact that all of us have at this time in the year. We are very comfortable with people's support and collaboration on all this, and we'll continue to work on that basis.
Could the proprietor, though, in future face fines or?
No. This is all focused around how do we ensure, in the context of an outbreak, we are dealing here with the people who are most at risk in this particular outbreak are people who are close, family, personal, workplace contacts of people who we already know to be positive. It is so important for us to continue to work with all those people to identify all their potential contacts to make sure that they are safe, they are well, and not at risk of transmitting it to anybody else. So the last thing we're going to talk about is any adverse measures in that context. We're exceptionally pleased, we're exceptionally glad of the support we're getting from the whole community, the whole Victorian community, but especially we now have 940 or so primary close contacts. We've got 1,600 people who walk through the airport. We've been contacting all those people. We are phoning people at 10, 11, midnight and giving them some very challenging news that says you are a primary close contact or you are a positive case, and people are being exceptionally supportive and accepting of that fact, recognising that they're actually contracting what is a very significant virus and has a potential significant risk. So we are very comfortable with that, and we'll continue to work on that basis.
Can I ask about the rate of transmission, if that's all right? At the moment, every person who is getting infected in this particular cluster, how many people are we seeing them infect?
So the numbers vary. So we have cases such as this where we've got cases in these clusters. If I go back to the 4 staff, CQV staff who originally contracted the virus on the 3rd floor. 2 of those staff have I think transmitted it to nobody else at all. One of them has only transmitted it within their household, and from there on the trail goes cold. We have one of those staff members who in turn has transmitted to her household, and they in turn, or she or others in her household have transmitted it onto other people. So it is highly variable. Again, Brett better qualified to talk about the nature of that. So we are seeing very differential rates of transmission from people who are currently positive in this cluster of 16 people.
How does that fit with the narrative about how highly infectious this is? There was a few experts on the weekend that spoke about this 70% figure that this UK strain is 70% more infected than the regular strain of coronavirus. Whereas I think Public Health England, their figures are sort of suggesting it's more like sort of 30 or 40% more infective. And every person may infect only 2 people.
Yep.
You know, why are Victorians being sort of, you know, told that, you know, that this is so highly infectious when it doesn't seem to be?
I think it's absolutely one for our Chief Health Officer to take. I'll gladly cede the floor to him. Brett.
Thanks, Jeroen. The original coronavirus out of Wuhan, in its natural state, infected 2.5 people for every case. It's always been the case that only a minority of people pass it on to anyone at all, maybe 30%. But that 30% who are more significantly infectious pass on to several people, and there are clearly those super spreader events as well, especially indoors, especially when crowded, especially if there's shouting or singing or very close contact. So that's the normal mechanism of transmission, and one case passing it on to 2.5 people is exponential growth. That gets to thousands within weeks. We're now looking at a virus that, again, reports are 40 to 70% more infectious than the previous variants that have been normal. Whether it's 40% or 70%, that is disturbing, and we don't want this variant of concern, the B117, first identified in the UK, to be in the community and transmitting, because a 40% increase in infectiousness, again, even from a minority of people, is hugely significant. So we just need to shut it down regardless. But it is a minority of individuals who pass it on to others. So there will be some who pass it on to no one else in their household despite being in close contact. There'll be others who pass it on to everyone in their household and are at risk of passing it on in social events or even in casual exposure sites. That's why we're just assuming that everyone here is significantly infectious and might pass it on in an open airport setting, might pass it on in a cafe, and absolutely at risk in a household setting. But in each and every circumstance, we are identifying those individuals, we are shutting down their close contacts and the contacts of those contacts on that basis.
On Friday morning, Minister Foley said that there was wastewater detected in Coburg. Do you now believe that it's as a result of the function on the 6th of February?
We can't say for sure. So it was a relatively early detection in Coburg. We're still encouraging everyone in Coburg and surrounds to step up for testing if symptomatic, absolutely step up for testing, as we've said, if there are an identified contact of an exposure site. So we make no assumptions and say, oh, it's all explained, nothing to be concerned about here. We absolutely encourage everyone in those wastewater sites, again on the website, and as Jeroen has listed, to come forward for testing.
We've got an Australian.
That there were no known cases, but a number of close contacts in those areas. Were those close contacts of people who had attended the venue?
Some of them will be close contacts of people who attended that venue, yes. And again, we're going through the testing process, and all others at that venue have tested negative. So that's encouraging. There's a couple that are still pending amongst all of those close family and social contacts. So 127 out of 129 is a pretty good wrap up, but we need to tie them all off.
So CQB was detected positive on the Wednesday. I'm assuming the viral fragments are detected on Wednesday and then reported Thursday. And then we only find out about the Coburg venue on Friday night. Why the delay? It's almost 2.5 days.
So the Coburg venue wasn't in scope because of that negative test the day after the event took place. So the event took place on the 6th. There was a negative test on the 7th. We now know, looking back and with reference laboratory testing of that sample, that it was a weak positive. So it's in getting another case out of that setting that we identified that transmission might have occurred there. That's why we went back and retested that sample from the CQV worker who tested negative on the 7th. But when you've got a negative test the day after an event, it's not in scope as an exposure site for someone who's potentially infectious, because you don't imagine them to be infectious.
Given the nature of the situation that Victoria is in at the moment with the lockdown, how can we feel confident that the system is working when we've got a negative test result that's resulted in a full week of potential exposure in lots of different environments, including a childcare centre, swimming pools, really highly populated and frequented areas?
Because we're testing 20,000 plus people every day, because 127 of 129 close household and social contacts are already tested, have already returned negative results, because we're identifying in record time cases from the time that they're testing, getting them interviewed and having their close contacts isolated. As Jeroen said, there are rare false positives, there are rare false negatives. We have to accept that that will occur. When we get new information, we reinvestigate, we reinterrogate those tests, those exposure sites, in order to be agile in our response. That's entirely appropriate.
Is it a failure in the
A week
system?
delay is surely not record time.
Sorry?
A week delay
A week delay in what?
in contacting this person.
So this individual tested negative after the event. So what do you expect us to do in those circumstances? We do not have exposure sites for people who return negative tests. All we can do is remain alert to any other result that comes through, to investigate those results, to find out how transmission might have occurred, and to wrap the public health response around those close contacts, which is exactly what we've done.
How do we feel confident, though, that that isn't happening on a fairly frequent basis, that those tests aren't coming back wrong and therefore exposing over several days? As what we're seeing here, this is now the highest amount of cases connected to one particular site.
Yeah, because we've got those 20,000 tests coming in every day, the vast majority of which are negative. So of 20,000 tests, all but 2 yesterday were negative. And we are not seeing other cases that are linked to negative tests. It is highly unusual to get a negative test on someone who was later found to be positive and in fact transmitted to other people. To be a weak positive, but to be infectious enough to actually cause infection in other people at an event is very unusual. But again, we have to accept the reality of that, be really agile in our response, understand that that was a transmission event, and wrap the public health response around everyone who was there.
So what was the trigger here? Was it because one of those family members at that event tested positive further down the track, or was it because that CQV member worker was identified as a close contact of another CQV worker?
No, so that CQV worker was quarantined after the event because they worked at CQV and the Holiday Inn was shut down and everyone was considered a close contact. But there was another individual at that event who tested positive, which made us reinterrogate that initial negative result.
How concerned are you about this event turning into a super spreading event? The venue's not a very big venue. There's 38 people. Presumably they were singing and dancing, very close contact.
Yeah, so clearly whenever you have an event where you've already seen transmission occur, you are highly focused on it, as we should be. The reassuring thing thus far is that there are a number of negative tests for those individuals. They are all in quarantine now. We'll actually retest them multiple times before the end of their quarantine period, because we know it's an at-risk event. But because they're all quarantined and because we've got all of those negative tests back at the moment, that's very reassuring. But we're going to be very highly focused on this event and this cohort of individuals who, again, as Jeroen said, have been fantastic in their cooperation with the department.
Are we revisiting other negative swabs now as well?
No. So if there's new information that links someone to an individual who we thought would be at risk and returned a negative test, we could reinterrogate that. But this is an exceptionally rare occurrence, but we would always follow the epidemiology that would make us need to reinterrogate any aspect of the response.
And it sounds like the tracing efforts have improved significantly from last year. The metrics you read out before, they're quite reassuring, I think, to a lot of people.
They should be.
And we're not seeing a lot of we're seeing a lot of negative tests coming back. Does that suggest that the snap lockdown across the entire state was maybe a little bit of an overreaction?
This is a high stakes game when a virus that has caused devastation across the Northern Hemisphere and many other countries in the world, and may soon be the predominant variant of concern globally, we cannot afford to be wrong here. As the Premier's said, and I can only reinforce it, we do not want to be in a situation a week from now, 2 weeks from now, where we said, oh, we wish we'd done that, because we've now got mystery cases, multiple wastewater detections, or cases that are beyond us. We have to be precautionary. It's an awful situation to have a circuit breaker of any kind, but it's done because we must get on top of this. There is really no alternative. We do not want to be in a situation where, again, you know, I don't want to make comparisons with Europe. We are not Europe. Most of Australia has really been free of community transmission for most of the last few months. But they have been in some kind of lockdown for 13 months of one kind or another. We do not want to be in a situation where there is ongoing community transmission that we are just trying to manage through rolling lockdowns.
Do you have any concern about the tennis player that's arrived in South Africa and now testing positive to COVID-19?
I don't think so. We've had these circumstances before where we've had notification through the national focal point, again under the international health regulations, that means that countries identify other countries where they think the virus might have originated. They've all been found to be not real results. So there are countries that do rapid antigen testing, not as sensitive, not as specific as the nasopharyngeal PCR swabs that we do. This particular individual tested negative on the day of departure, but was on a long flight, mixed with other international travellers, again, you know, with a significant risk of cases potentially on the subsequent legs of that flight. We will go through the normal process through the National Incident Room to inquire of all of the information that South Africa can provide, and we'll tie off those ends, but I don't think it's a real result.
Foley, would you like to comment on the Australian Open as well and what this means for it?
I reinforce all the comments the Chief Public Health Officer's made. As I understand it, the gentleman tested negative departing from the international terminal, not Terminal 4, and my understanding from reading the authoritative newspaper this morning was that his advice from his medical staff in South Africa is that he's picked it up in the Middle East.
Can I ask you? I'm sorry, I was just going to say, you went on radio saying that this virus is 40 to 70% more infectious. The UK government executive agency, Public Health England, says that it's roughly 34%. Is this a bit of a scare tactic?
No, I take my advice from my Chief Health Officer, and my Chief Health Officer gets his advice from the world's and Australia's best epidemiologists, and that's where I'll take my advice from.
Just back to how the outbreak actually started, would you like to explain how this started?
I refer you to yesterday's comments by everyone involved. My focus is I want that family to put all their efforts into getting well. So thank you very much. We've got a lot to do today, as you can well imagine.
Park Hotel. We're hearing that there's an infection within the Park Hotel, used to be the Ridges. Have you got any information about that?
Say that again?
The Park Hotel. We're hearing reports that people inside the hotel, so the refugees living in there.
Oh,
inside the hotel.
yes, I did hear that there was some media comment about it. No, there are no reported positives at the Park Hotel. Thank you, everyone. We're very busy today, so we need to get on with our day jobs. Thank you, everyone.